Well, COVID numbers in the valley trending down. New information from State Health Services showing cases, hospitalizations, and deaths trending down. Hospitalizations in the RGV almost a full percentage point over last week alone. That's decreasing, that is. And that's a metric used to determine hotspots around the state. State health officials credit the valley's high vaccination rate for the decrease.
That red line kind of represents where the state is as far as average fully vaccinated. So as you can see, most of our counties are at or above that number. Many of our counties have surpassed now the 80% mark.
And that good news coming as health officials track something we've seen before.
Unfortunately, we're back into the beginning of what seems like another wave.
That's Dr. Pro. She's the regional medical director for the state. She says 44 Omicron cases are confirmed in Texas.
And while health officials believe the Omicron wave may soon head our way, the message now, stay the course. Here's Channel 5's Rudy Mireles.
As of today, COVID case, hospitalization, and death curves in the valley are flattening out. A good sign of progress and possibly the new normal.
People are still testing. We are still seeing confirmed cases, and that's going to continue.
Those tests in high demand once non-essential border crossings returned last month. And with the holidays, Nathaniel Ruiz, a scheduler for RGV mobile COVID testing, says they've seen a new #1 reason for a test.
Family gatherings out of town, heavily populated cities such as Houston, Dallas.
Something Regional Medical Director Dr. Emily Pro recommends this holiday season.
Before they meet with grandma, grandpa, or others who might be immunocompromised in their families or friends, that is a good practice.
Compared to last year, advances in COVID testing have made that process easier, from more test options available to how we test.
And PCR testing is a lot more efficient and a lot less invasive than it was this time last year. RGV mobile COVID testing, for example, using these little spittoons. All you have to do is drop a little spit right in there, give it back, and in about 24 hours, maybe a little more, you'll have your results back on the gold standard of COVID testing.
A big positive change, according to Ruiz.
Back then, you'd have to wait about 3 to 5 days.
Pro says the increased testing is another tool in the box for public health professionals as Omicron makes its way here.
We have higher vaccination rates compared to other parts of Texas, so our community is prepared and as prepared as we can be with this new wave coming on.
Dr. Pro adds doing things that we have been doing all along throughout the 2 years of this pandemic are going to be key. Things like wearing a mask, keeping your distance, washing your hands, and of course testing if you think you need to be tested. She says doing those things over the coming months will be critical in fighting off any potential wave of Omicron trying to overtake the valley. In Harlingen, Rudy Mireles, Channel 5 News at 6.